Okay, good morning. This is scenario 3. Patient is 36 years old who presents to urgent care after a bicycle accident, complaining of mild headache and a 5 out of 10 throbbing pain in the wrist. Hi there, my name is Adette. I'm going to be doing an assessment on you today. I know you had a bicycle accident and you were complaining of a mild headache and your wrist hurting. So I'm going to do a neurological exam on you, and then we'll do a musculoskeletal exam on your wrist and see what's going on, okay? So I'm going to ask you, do you know where you are?
Yes.
Yes? Where are we?
Urgent care.
Okay, can you tell me your full name and your birthday?
Delilah Gonzalez.
And your birthday?
9/11/86.
All right. Okay, I'm going to go ahead and check your pupils, okay? This is just going to tell me that they react to light. Do you mind taking off your glasses? And I'm going to just flash a light. I just want you to look at my pen, okay? Well, or look at me while I flash my pen, okay? All right, looks good. You can put your glasses back on. Okay, next I'm going to check for sensation on your face, okay? I'm gonna ask you to close your eyes and I'm gonna touch your face and you're gonna tell me where I'm touching, okay?
Forehead. Cheek. Chin.
Okay, perfect. Okay, I'm gonna ask you a few questions, okay? Can you repeat the phrase apple, table, penny for me?
Apple, table, penny.
Okay, and can you tell me the year, the month, and the date?
February 23rd, 2025.
All right, now let's take a look at your wrist, okay? I'm gonna look for any visible signs of injury, okay? All right, and then I'm gonna touch it. Is it sore or tender anywhere that I'm touching it?
Yes.
All right, we're gonna do a little bit of range of motion, okay? Do you mind bending your wrist up and down and rotate it in a circle if you can? Okay, perfect. Okay, now I'm gonna ask you to put your arm like this, and I'm gonna apply some pressure and try to give me, all righty. Okay, so the patient's head and neurological exam shows no immediate signs of concussion or traumatic brain injury. The headache is likely mild and no alarming neurological symptoms are present, but they should continue to be monitored for any changes. The wrist shows signs of mild soft tissue injury like sprain or contusion with localized tenderness and limited range of motion. There is no indication of a fracture or dislocation, and the patient may benefit from rest, ice, and pain management for the wrist.